City of Miami. The city.
Otherwise,
Slaving and.
No, it does not. You're like, no, I don't. Not really.
Are we ready? This time I'd like to call the 5/15/2026 meeting of the Board of Health to order. First item is roll call. Jenny, can you help me?
Here.
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 Here. Here.
Okay, we have a quorum. So the next item on the agenda is the adoption of the agenda. So hopefully everybody's had a chance to check it out. In a motion,
I make a motion to adopt the agenda. Second.
a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item is the approval of the minutes from our June 24th, 2026 meeting. Hopefully everybody's had a chance to review that. And any questions or comments or concerns? I entertain a motion.
I make a motion to approve the minutes. Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. Board President announcements, I'm going to reserve. When we get to item 2642, I'm going to just give a little history on the wastewater advisory board and the on-site sewage disposal board. So there's something to look forward to. Other than that, move on to the next item. Health officer's presentation and report.
I would just want to make a few notes about the board packet that you got. One of the things I wanted to point out to you with the care unit is that they're doing about 2.25 events per day. There's over a 12-week period, they were having 11 events a week. And so they've been keeping really busy, and we're proud of all the work that they're doing. That in general, the chronic disease program is giving us information on page 9 of your board packet. You'll notice that approximately 1 in 3 of the people that are screened for chronic conditions, those being blood pressure, high hemoglobin A1C, which is associated with prediabetes and diabetes, elevated BMI, elevated lipid panels, that more than or around 33.33 or 1 in 3 people have more than one test that's abnormal, which to me is very telling. And the idea is that we're trying to find these people that may not otherwise have access to this testing, and to educate them about things that they can do in terms of diet, nutrition, and also try and get them hooked up with a PCP, because many of the people do not have a primary care provider. I would also like to point out that our EMBER program is busting at the seams. since the classes started again in February of 2026, we've had 393 participants. So that is just incredible. It's really grown by leaps and bounds since we went online, and we have really quality educational lectures, talks by local healthcare providers, and the team is doing incredible. They're just knocking it out of the ballpark. The MIH CHWs have been doing car safety seat inspections, and in that 12-week period, they did 123 home visits. So that's how we're getting support for these new moms, helping them through with, if they're breastfeeding, answering their questions about newborn care, about themselves, looking for mental health signs and symptoms, and making sure that they have follow-up too. The things that you'll notice that our MIH social needs assessment, the number one thing out of 40, on page 11 on figure 7, you'll notice that 40 of the participants needed help navigating, getting hooked up. They didn't have health insurance at all. The PCP referrals and OB prenatal referrals, again, we're finding it about 50% of our clients. On page 12, you see that about 50% of the women, 75% of those that we registered were uninsured, and about 50% of them did not have any access to care. So we're providing a huge need in the community. You'll notice that out of the 48 people, in terms of ethnicity, 40 out of the 48, 21 or 44% were Hispanic, 19% were Black, and about 25% were white. So we're trying to look at those zip codes that you see on 13 where the greatest needs are, so that we can really try and concentrate helping where there is a need. I also want to bring to your attention on page 30, where there's a survey of, I think there were 20 participants in this particular survey that nursing gave, and all of them were favorable. I thought if I was answering, I always answer something is wrong, but they found nothing wrong. And so that's very telling. I know it was a small survey, but I'm very proud of the nursing team, and they obviously give out some sort of positivity to our clients that use the nursing department, and I'm very thankful for that. I also, along the same lines on page 28, the public health nurses, boy, they just get calls after calls after, especially now with stuff that's going on in the news, but they have 15 animal bites. They average 15 animal bites a week, which is 3 a day that they have to follow up on. And communicable diseases, they're averaging about almost 2 a day. So about 8 a week they're getting on communicable diseases. Now is different, it's really popping, but I just really appreciate that. I appreciate the school health liaison getting bereavement assistance for local schools through a new partnership with Dustin's Place, which helps kids get through tough times, and providing free hearing screens to students at a local school, just being available for these schools that need help for their school age children. So I won't go on and on about that, but I will want to go on and on about our foods team. They just got through 4-H Fair Week. That is like the rock concert of the year sort of thing. They start early in the morning, every single doggone day. They actually start before the fair starts. Environmental's out there checking the water. Foods is out there doing all the vendors. And I just really appreciate their creativity. Every day they give out a colorful, informative fun newsletter. If you want to see them, they've got crossword puzzles, they've got word searches, they have Sudoku, and they even let you have either easy, medium, hard, or evil as part. And they even had pictures where you could spot, instead of where's Waldo, spot the crime or, the ordinance that's being, affected. On the last day, they actually passed out the key so you could see if you got it right or not. They also gave out awards to vendors who had perfect inspections throughout the entire fair. There were different categories. They gave out the 3 different categories, and some people got honorable mentions. But this was put out, and I'm just so proud of them and how they took a really difficult assignment and, again, hit it out of the ballpark. It's just incredible. And out of this, we'll hopefully grow into, move over into a space on our social media, just as an information piece for the public and about food inspection. And I'm really appreciative of that. All right. I also want to give a shout out to environmental. St. Joe County, I compared it to other counties in the state, but right now only 16 of the 92 counties in St. Joe and Indiana are reporting mosquito information. And St. Joseph County, I know that she put over 500 miles on the car or on her vehicle last month. So she's leaving no standing water unturned, but she tested 82 pools and 2,623 mosquitoes, and only one had West Nile virus. But the point is, when we look at other counties around us or with similar populations, it's half of what, I'm just really impressed. And our septic team has stepped up. Environmental has been working really hard, and they've been dealing with all the massage ordinance stuff. And I could be here all night, and I know you don't want to be here all night, but I could just talk about every doggone unit, how they're stepping up and really doing terrific work. And if you want to see it, I'll show you. I feel like a mother with her kids' art projects and stuff, but I'll stop talking, but I'm just really proud of them.
Appreciate that very much, and great job of the team. My gosh, very creative on the fair thing.
It's awesome. It really is.
A lot of fun, and what a great way to promote the code and safety. Anything on the West Nile that we need to know? Should just continue.
Just, we had one, Elkhart County had one, Hamilton County had one, Marion County had one. And we did, as we promised when we started, we revamped our program a little bit, focusing on that larviciding. And by golly, she did focus on it. She got to those pools and got them treated with the organic matter. So hopefully we won't be spraying as much. No, we did spray outside the perimeter of the 4-H fair because our goal is, and if anybody from environmental wants to correct me or add to this, our goal is to spray at where there are large events when we know that there's diseased mosquitoes in the area. So one West Nile virus.
Thank you. Any questions, comments? Dr. McLeary?
I guess this is kind of an awkward topic, but I noticed WVPE, they had an article with where Ashley Hellman was interviewed about explosive diarrhea. So that's the awkward bit. But which was informative, but you were talking about communicable diseases. Is that one of the things we're tracking right now, or how are you specifically tracking it? Or?
We are tracking it. It's a reportable disease, and we are required to report it to the state, which we are doing.
What is the actual name of this disease?
Cyclosporiasis.
Cyclosporiasis.
It sounds like psoriasis, doesn't it? Cyclosporiasis, and it is really, you have to come in contact with, it's found in fecal matter. And so the things that we're focusing on is educating people about cleaning their produce. which may have been in a muddy field that had maybe contaminated water that was on it. But I can't, it's not transmittable from human to human, except if I wasn't being super clean and keeping my hands washed well, and then preparing food, or cross-contamination if you had produce that wasn't cleaned well, and then you use the same cutting board without washing it with soap and water well between times, or knives between times. But the thing about this particular parasite, it is a parasite, is that it's a long incubation period. It makes it difficult to track, because if I asked you what you ate 2 weeks ago, could you tell me 2 weeks ago today? It has an incubation period of 2 to 14 days. And so doing the contact tracing after you find somebody who has it can be very arduous. The other thing is the testing that is done is very expensive. It's PCR testing, which is expensive. It can be up to like $495 to do that particular stool test to find it. So it's usually no one has died from it nationwide. No one has died. There have been people who gotten dehydrated because they were not able to keep up with their fluid loss, but they go in, they get IV fluids if they need it, but it's often a self-resolving illness. And again, it's not transmissible from human to human unless you're not practicing, good hygiene.
Can it be transmitted from animal fecal matter, or is it just human?
It-
Human to human fecal matter?
Like chickens can't get it, for example.
Okay.
You can feed chickens any produce you wanted, and they're not going to catch it from the produce that you throw out of your refrigerator into their pen.
But like dogs or cats?
I don't think they have the one that we have.
Okay, okay. So it's not, I mean, besides general hygiene and cleanliness, it's not.
You just want to wash those hands well.
But like animal,
Right.
yeah, that's not something.
No.
Okay, besides general hygiene and cleanliness.
And hand sanitizer does not work against the cysts of the parasite. So it's really got to be good old fashioned, wash your hands well with soap and water.
Okay.
It's really, they're really like those crevices, that's why they talk about raspberries or the cilantro, because it can get into those cracks and crevices, the cysts can. So,
Okay.
that's why it's difficult to clean. And they say, if you want lettuce, buy a head of lettuce, take off wash it, but also take off the first couple of layers of the lettuce. So vinegar doesn't work, lemon juice doesn't work, all those things
Just soap and water.
don't kill the cysts. You now know more than you probably wanted to know.
What if washing your produce, or like you buy raspberries? I mean, do you not just rinse? Would you do something besides just?
If you can
rinsing
use
it?
a brush on it, like cucumbers, they suggest brushing. It's really hard to clean lettuce, but if you have a lettuce washer, you can
Mhm.
really take off the first few layers, get that water, run it over a lot, and then spin it out.
Does it die if it's cooked?
Yes, if
Oh,
it gets
okay.
if it's cooked, if you're really nervous, cook anything that you eat that is fresh produce. So
So maybe save your raspberries for jam.
yeah, make jam or make a pie or cobbler or something where the temperature is going to be over, I think it's 168 degrees or 158 degrees. And microwaving doesn't work as well because it doesn't heat evenly. You need to have it baked in an oven or on the top of a stove.
I guess one of the other questions I had, when you're talking at the MIH program, and connecting with resources, I guess I'm looking at page 12, but one of the reasons why the program started was to get women in to have their first visit, especially with the OB, much sooner in their pregnancy than seemed to be the case with some of the backlog with trying to get insurance together and everything. And I think we've been seeing that, but I wanted to kind of get the sense from you, like, has this program resulted in pretty consistently women that time period between when women first make contact with one of our community health workers for help with insurance and navigating to find an OB and their actual appointment. Has that kind of time period?
I don't think
Shrunken?
it's shortened, but we've tried to get people in during that first trimester.
Yeah.
That's really the goal, is to get
Yeah.
people start out on the prenatal vitamin right away
Uh-huh.
if they're not already on it, and then get them access to care during the first trimester.
Yeah.
And it's always been challenging because we have a shortage of people that are doing obstetrical care. And it's challenging, but if we can at least get them in to the office, they can get screened, get their prenatal labs done. And often they have a nurse or a nurse practitioner or a physician's assistant who can do a lot of that screening, get the blood, get the show on the road. They may not see the obstetrician right away, but they can at least get, the parts moving. And so most of the people that we see are in that first trimester, and that's encouraging. It goes down significantly from the first trimester, then the second trimester, and then very rarely is it the third trimester.
So it really is able to capture that demographic of women in their first trimester and get them into care
First trimester
when they
is really
need to
important.
get established. Okay.
We're in 3 women's care centers right now that we provide staff, staffing.
There are only 3 in the county, right?
Right.
So yeah, because you're rotating among them.
Yeah.
Okay. And then how do you find out, like, when you're doing the home visits, how do you kind of make that determination of who gets a home visit? Is it kind of the women themselves who are kind of saying, I could use that extra support, or is it, yeah, how does?
It's totally voluntary. They don't have to do it. We don't
Mhm.
want to barge into
Yeah.
anyone's personal space. So if it's offered and if it's accepted, then we make sure that they get that service.
Any other questions or comments on the health officer's report? Going through our spotlights?
No, but I am glad you brought those for us to, so thank you. Thank you for sharing.
Yeah, it's really awesome. I'll pass them around while you guys are listening.
In the environmental group, it looks like the septic system permitting is up substantially. Are we keeping up?
Yes, we are keeping up. Our septic team is really doing a good job, and a lot of new construction. But I'm not going to say they're not taking Geritol, but they're keeping up one way or the other.
It must
Nope.
be, because if we're not hearing any negative feedback.
Their numbers really look good, and we're able to look at that. They're moving ahead with Red Cap, which really helps us capture the data, and phenomenal. They're doing a phenomenal. I cannot say enough about them.
All right.
How are you?
I'm great. How are you?
Good.
Good. So I do want to just start out by saying the first thing I said was foul smelling diarrhea, but Jeff thought that was a little underwhelming. So apparently we went with explosive, but I have the opportunity tonight to share with you the unit spotlight for the nursing unit. Give you an overview of what our year looked like, the accomplishments and impacts that we were able to have on the community while working through challenges. So in public health, the first thing we say is to expect the unexpected. So we can't always predict when we're going to see the next outbreak or what the next emerging public health threat might be, but we can be prepared for it. And so that's what our team does every day. They train, stay up to date on education, work with community members and partners, and prepare so that when an emergency or outbreak happens, we are ready to go. And that helps for the community to feel confident that we are here to support them. Next slide, please. I'm going to talk about each of the subunits in nursing, but before I do that, I just like to put up some big numbers, and overall information. We provide a wide range of services across our 6 subunits, impacting people across the lifespan. And the numbers show some of the scope, but they don't show the entire impact because every number represents a person served, a community impacted, a family treated. The time frame for the data that you're going to see in this presentation is June 1st of 2025 through May 31st of 2026. So we wanted to get a year prior to this presentation. And we're going to take a closer look now at some of our units. Next slide, please. Thank you. Our first unit is our TB team. They have worked really hard doing a lot in their testing and screening areas. They have cross-trained staff, so almost all of the staff on our unit are able to place both skin tests or draw blood tests. They've put on large-scale testing events for both skin and blood screening, which just gives more flexibility to the community and better access to screening. And the reason that that's important is that helps us identify latent TB cases before they become active and allows us to get people treated while they are still not contagious. Our team has been recognized for their expertise. We get phone calls from providers in our area because they realize that our team works with TB day in and day out. So if they have questions about, hey, what do you think about this lab? What do you think about this chest x-ray? What do you know, either the team can provide them guidance or connect them with the state. And we're really lucky because our team members, many of them have been in the TB space for a long period of time. Even the state, our neighboring counties reach out to our county because we have such longevity in our TB nursing program to ask for assistance if the regional TB nurse is unavailable. So it is great to be able to expand our reputation beyond just our county and support other nurses working in this space. Our TB team noticed a problem and they worked to solve it this year. I'm really excited to share. So I talked about our latent TB patients. If you have latent TB, you are not contagious. You don't have any symptoms, but we don't know when you may become active. So it is important to treat. Unfortunately, most latent TB patients do not have a primary care provider, or most patients with latent TB don't have a primary care provider and they don't have insurance. And if you've tried to get a patient into a clinic, a sliding scale clinic or a no-fee clinic, you know that there's a long wait just because there's a lot of need. And unfortunately, we were losing patients to follow-up because it was taking upwards of 6 months to be seen by a provider. So they went out and communicated with partners in the community, and they were able to work with HealthLink. We now have an agreement with HealthLink. They hold appointment slots for our latent TB patients. They're able to get an initial exam, have their labs drawn, and then they follow up with their provider for labs and side effects during their treatment. Our team continues to ensure that they're getting their medication. They do the observed therapy as needed, answer any questions outside of that relationship. But the most important thing about that to me is that now those patients have a primary care point person. So after they're done with TB treatment, they have a care person to go to. And I think that ensuring that people have care beyond just what we're providing is so important. We really do our team walks with the patients from start to finish. And patients have said that we make what can be a scary and frustrating process feel manageable. And one patient said, quote, they said, "This is what healthcare is all about." And yes, I think walking with patients, providing information to the community, and ensuring that people are treated appropriately, that is what healthcare is all about. All right, next slide, please. So we also have our immunizations team. We have our South Bend clinic here, and we have our mobile team as well. We gave over 5,000 vaccines in the past year, which was fantastic, to almost 2,500 patients. We work really hard when we vaccinate to provide education so that patients understand what we're doing and why we're doing it. And our teams really made miracles happen last year in the face of difficulties. You know that we made the hard decision to close our Mishawaka location last year, but our mobile team just picked right up. They went out and worked to set up more clinics in the Mishawaka area so that we could still provide service to that population. And we'll talk more about that in a minute. We did see some decline in patients, and a lot of that is in large part due to some respiratory vaccine recommendation changes. Next slide, please. So this past respiratory season, there was a change to the COVID vaccine eligibility. In previous years, if you were age eligible for the vaccine, you could get that. It was completely optional. But now in the recent years, you have to have a qualifying condition to receive the vaccine. And so you can see we had a slight decline in flu vaccines given, but we reduced our COVID vaccines given by about 70%, and that really impacted our overall numbers. We've seen that there is an increase in vaccine hesitancy, and again, more education needed. And so we just take that time with our patients. Our team works really hard to address all of the challenges that they see. And I mentioned our mobile team having more clinics in the Mishawaka area. And next slide, please. So here is a potentially difficult to see, but a map of some of our clinics. We had over 100 events last year, mobile events, and we worked really hard to partner with the City of Mishawaka, City of Mishawaka, and other partners in that area to provide clinics, as well as partners throughout the community. And we were able to have a very successful year because of that. We did other things as well. We looked at all of our appointment data in office here and have added targeted appointment slots where we see a lot of no-shows. We increased our staffing. We implemented the Babe Coupon program. We brought that back in. So that is a program where parents are incentivized for their kids to be vaccinated at no cost to us, but they get a coupon and they can go use that on baby products at the Babe store. We worked really hard on the things that we could impact. Next slide, please. And one of the things that we did was we implemented the patient experience survey, and that whole survey is in your packet. And as Dr. Bigliori said, we were blown away by the results, honestly. We implemented it so we could see where we could improve. There's always areas to improve, but you can see with the overall experience here exceeds expectations. Almost every person chose that, and that is just a testament to the respect and care and communication that our team has with every person who walks through the door of our clinics. Next slide, please. This is just a piece of custom artwork that one of our patients created and delivered. This was a middle school child new to the United States, had to get caught up on some vaccines, spoke no English, parents spoke no English. Our vaccinator utilized the language line. If you've ever used a language line, you know that that takes a lot of time. But she was committed to making sure they understood every step of the process, and they requested her for their follow-up visits. And on the final visit, when the student was caught up, she brought this beautiful piece of art. She asked to take a picture with the vaccinator. And it's those types of things where we know that we see that we're having an impact even on a single person, that makes what we do worth it. And we know that that trust is earned every day through the way that we treat our patients. All right, next slide, please. Our next team is our public health team, and public health cases are referral driven. So they come to us from the state Department of Health, from community partners and labs. And so our team worked really hard this year to improve community partnerships and increase the efficiency of the cases that they investigated. One example is animal bite cases. So we get animal bite cases from multiple sources, but the team was noticing that we were getting some of these reports late. And it's really important, especially for animal bites, that you get the person treated quickly, especially if you don't know the animal's rabies status. And so they worked with one of our community partners, Animal Control. They met, they identified areas on both sides where the communication could improve so that the information was able to more quickly be reported to us, which allows us to more quickly investigate the animal bites. And we have seen an improvement in that in recent months. So that was fantastic. They also continue to respond to communicable disease cases. They manage lead, elevated lead levels, and they do this while staying up to date on state reporting requirements and interventions. So they are always ready. Next slide, please. Now, our lead program has its own spotlight, so I like to let the expert do her thing, but I do just want to share a little bit about the lead program. The lead program is guided by our coordinator, and we also, in the nursing department, our public health nurses work with lead cases, but lead also includes our environmental units, our care units. It's really a whole department program, and it is so important. This last October, our lead coordinator, as well as the care units, put on some test and treat events. They provided education to parents about lead poisoning prevention. Any child who came under 6 that received a lead test was entered into a drawing for some really cool prizes. And it's these kind of creative things that allow our program to test more and more children every year, and to catch those children whose lead levels are high and need intervention. Our lead coordinator also does education with providers, just letting them know about lead reporting and testing requirements so that they understand what they are doing, or if they have any questions, she's always happy to answer them. And our public health nurses managed 52 children this year who had an elevated blood level above 10. All right, and then our last area is our school health unit, and she actually has a spotlight coming up very soon. So again, I'm just going to kind of give you an overview here. But our school health liaison moved into this role mid-year, and we think she did an amazing job with a partial year in the role. And we are so excited to see what she does next year when she has a whole school year. But you can see she completed almost 500 school contacts. Most of those were in person. We're excited to say that she visited all 105 schools in St. Joe County. We keep finding more. And she was able to do that to build relationships with the people working in the schools. She made sure that they had access to unexpired epinephrine, AED supplies, and Narcan. And the cool thing about the school program is that there are many different ways that the liaison impacts the staff in the school, the students. And I'm just going to tell you about a few different ways that she impacted students. So one thing she does is hands-on education, and she provided dental education this year in person to over 400 elementary students. Each of them got a little bag with the floss and the toothbrush and the toothpaste and all that good stuff. And that was one way that she provided care. Now, there was schools that wanted that information and they wanted those resources, but they didn't have the time in their schedule to be able to have someone come in. And so for over 200 other students, she delivered kits with information attached, and they still got all of those great resources. She also connects people to other partners. So you'll see here, hearing screens are listed. At the end of the school year, we had schools reaching out asking for support in their hearing screens. At that time, the department did not have an audiometer. And so what she did was she reached out to St. Mary's and the Indiana Department of Health hearing team and was able to connect them and get almost 300 children have their hearing screens completed. And then the last thing that she does is advocate. And I think that's an important thing for all of us, but there's a program in our community called Kindness to Prevent Blindness. You've probably heard of it. It provides vision screenings and free glasses for elementary age children who don't have access to this at home. And she had 2 schools approach her, a middle school and a high school. And they said, we love this program, but we need it for our kids. They can't see and they're struggling, and there's nothing for middle and high schoolers. So she was persistent and she reached out to her contacts at Kindness to Prevent Blindness and was able to get them to agree to provide this screening for a middle school and a high school for the first time that we're aware of. And this is just another example of her removing barriers through partnership and advocacy. And that's something that we like to do in the nursing department. All right. Last slide, please. Thank you. All right. So we had a very successful year despite challenges. We adapted to change, built partnerships, and just worked to protect and promote community health. And the data tells an important story, but it only captures part of that impact because behind every number, like I said, there is a person. Behind every vaccine administered, every case investigated, every school visited, there is a dedicated team of professionals who are committed to improving the health of our community. I want to take this moment just to thank the staff, the nursing staff, for their professionalism, their compassion, and their willingness to adapt to changing public health needs. Their commitment to serving others is reflected not only in the work that they've accomplished, but also in the trust that they've built with our community. And as we look ahead, we're going to continue to build on this year's successes. We're going to learn from the challenges that we've faced, and we're going to continue to seek new opportunities to improve access, strengthen partnerships, and advance the health and well-being of every person in St. Joseph County. Thank you for your time, and I'm happy to answer any questions.
Thank you, Ashley. And on behalf of the board, thank you and your team for everything you do. Great work. Oh, what a great year. Any questions or comments for Ashley?
I wanted to say, well, first of all, I just wanted to comment that I think maybe reaching out to the local colleges, the St. Mary's partnership, I mean, that is, and does IUSB have a similar program?
Not that I'm
Not
aware of for
audiology.
hearing screening, but maybe
Yeah.
they do. Some of the colleges do things in certain semesters, but not others.
Yeah.
So I believe that St. Mary's has the spring program, which is why she was able to connect them.
Okay. I mean, I think it's great. It's kind of a win-win because it's a good experience for the students, and it's a hopefully a good chance for these kids to get the testing, the audiology and other testing that they need. And so I thought that was great. One thing that struck me with just the number of people who come to the county health department to get immunized, I mean, that it made me realize in a way that I hadn't really thought of before of just the sheer number of people for whom that is like their touch point with the department. But also I was curious if you knew, can people from outside the county, do they come to the county health department, our county health department for vaccines for other,
Yes.
or maybe for other nursing services too, but
For vaccines, yes, we accept people from, we even get people from Michigan who live right across the border. Sometimes we're the most accessible place for them. For things like TB and public health cases, they
Yeah.
have to reside in our county
Yeah.
to be assigned to our team.
Okay. That's what I assumed, but I didn't quite realize that, oh yeah, people from outside the county can probably come here because I guess it's not like state funding. They have to pay for the vaccine through their insurance or Medicaid or out of pocket. So
Yes.
that's why you probably can.
And any
accept-
person who has Indiana state Medicaid,
Uh-huh.
we do use state vaccine for them, but if they had Michigan Medicaid, they wouldn't qualify. They would go to Michigan. So
Okay.
it's for people with private insurance, people who are uninsured, and then typically travelers. We get a lot of travelers who come here because we have a pretty robust travel vaccine clinic as well.
Cool. Thank you. Very informative.
Anything else from the board? Thank you very much.
Thank you.
Appreciate your efforts. So on item 2640, health officers report, I think we need a motion to approve the report.
I will move to approve the report. Second.
Motion is second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next section of the agenda is new business. Item 2641, discussion and vote job descriptions. Mike.
Hello. Before you, you have 4 job descriptions included in the packet. As with last month, we're getting kind of down to the point where there are no major revisions to these job descriptions. They are reformatted, clarification given where things maybe were not quite as clear. Duties have been reordered in order of importance or primacy, and then we work our way down the list. And of course, we've added various standard language throughout the entire document. And so these are the same as what we have done in the past couple of months. I am happy to answer any questions about them if you do have any, though.
Thank you. Any questions or comments?
I make a motion to approve item 2641.
Motion and a second. Any further discussion? Ellen, anything from you?
I mean, I looked over them a while ago, so it's kind of the same sort of language and that we've been using consistently. So.
Thank you for that. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries.
Thank you.
Thank you. Next 2 items on the agenda reference or refer to our on-site wastewater advisory board and I believe our water resources advisory board. So if you'll indulge me for a few minutes, I'll give you a little bit of history just on these boards on the program. So back in the 90s when we had the Superfund, the spill up in Granger from the lumber treatment, and that's a lot of contaminants in the water. Environmental knows more about that than I do, but anyhow, we got a settlement out of that. The county got, I believe, $250,000, and the county chose to use that to create these ordinances to protect our groundwater. So in 99, they passed the surface and groundwater protection ordinance, the well drilling and water supply ordinance, and the wellhead protection ordinance, all focused at protecting our groundwater. So some brief information here on the Water Resources Advisory Board created by that ordinance. Is a 15-member board appointed by several bodies, including this body here, Board of Health, county commissioners, county council, the mayors of Mishawaka and South Bend. That board is required to meet annually, and their duties are generally to advise the county Board of Health, to advise us on regarding wellhead protection areas, to review wellhead protection ordinance and create, if necessary, and update, if necessary, at least every 4 years, the actual ordinance. Advise the health officer and the county Board of Health on all matters concerning groundwater protection and drinking water supplies. So that's what that board does. Of course, they work, our staff, environmental group works closely with the board and organizes them and sets their agendas. In 2005, this very board recognized that poorly constructed and our septic program was a little weak, and that we, with a little bit of tweaks and not much impact to homeowners and the cost side of things, we can make a big difference in the septic program. So that board recommended to the County Board of Health that a new ordinance be passed, an updated ordinance be passed for septic systems. That happened in, I think 2007, sorry. Anyhow, on the recommendation, the county council did pass an ordinance, on-site sewage, and created the on-site sewage disposal advisory board. That's a 15-member board, again, with appointments from this County Board of Health, county commissioners, county council. And that ordinance requires that that board meet at least 4 times a year. So it's a pretty heavy lift. Again, their duties include advising us and the health department on issues regarding septic systems, reviewing septic system ordinances at least every 4 years, and advising the department and the County Board of Health on all standards regarding and concerning septic systems. So they, if you recall, I think 2 years ago, we updated chapter 51 of the septic ordinance. That came out of that board. They took the lead on that for us and gave us advice on the wording of that ordinance. So on our agenda today, we have a couple of appointments to renew, and in the coming meetings, we'll be looking at some candidates to fill positions on the board that we're required to fill. Also, just while we're talking about the on-site wastewater advisory board, I think we're going to be seeing from them, I hope, a request to update our current county ordinance on septic systems, and that's due to changes that are occurring at the state level. With that, we'll get down to business. Dr. Migliori or Freezy, anything to mention there? Is that good? All right. Any questions on those? Pretty exciting, huh? All right. Item 2642, discussion and vote of the appointment, reappointment of on-site wastewater advisory board members, Dave Jeffers, who fills the hydrologist role, Dr. Hellenthal, who fills the biologist role, our at-large position, which this is a new appointment, David Ekins, who's on our team. And then we're in the future meetings, we'll be coming to you with somebody representing municipal water and wastewater systems. So I think that's our proposal. We vetted everybody, the 3 individuals, and recommend to the board that they approve. Happy to entertain any questions on that.
I'm just curious how, well, first of all, I'm assuming everybody who is being nominated is willing to serve. Okay,
Yes.
that's important. How long have Dave Jeffers and Ronald Hellenthal been on the board? Do you know?
I was on the board from 99 until 2019, and they were there step of the way I was there. So I'm guessing 30-ish years. I think it was 25 years.
So there's a lot of experience.
Yep.
I make a motion to approve item 2642.
Second.
Thank you. We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item, 2643, is a discussion and vote on appointment, reappointment of our appointments to the Water Resources Advisory Board. Again, Dave Jeffers, Dr. Hellenthal. We're still looking for a chemist, and we're still looking for somebody representing hazardous substance management. Coming to you in future meetings with those, we hope. But that is our recommendation to the board to reappoint Dave Jeffers and Dr. Hellenthal again to this board.
I make a motion to approve item 2643.
Second.
Thank you. We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. And please pass on our thanks to those who agreed to serve again. Next item on the agenda, 2644, discussion and vote receipt and use of in-kind donations for the 2026 Bike Safety Rodeo to be held September 26th, 2006.
Hi, Ashley Hellman, Director of Nursing. I'm here on behalf of our school liaison who has a bike rodeo coming up in September. She would like to ask for and receive donations for snacks, for raffle items, possibly like a bicycle, things related to bike safety, for the upcoming bike rodeo. The snacks would be to support the volunteers who will be at the event during the day, and the raffles will be just for fun. I'm happy to answer any questions.
Or do you have any questions for Ashley?
I think I asked, but Dr. Migliori this earlier, but I've heard that it's going to be at the Mishawaka Ice Rink.
Yes, so yes, in the summertime, it is not an ice rink, but yes, so the Ironworks Plaza, I think is what it's called potentially, but they have partnered with us to be able to hold it there.
What's the time period?
Um,
Like the hours?
I believe that it starts at 10 o'clock in the morning. I know I need to be there at 9 o'clock as a volunteer. So if anybody wants to volunteer, I'll see you there. And then I believe that it runs officially until 12:30, but we have our licensed cycling instructors through 1. That way, if we have anybody who arrives late, we can still get them through all of the stations, and we don't have to turn anyone away.
And are you, well, I guess it's probably a little early to market for it yet, but, or are you planning to market at like back to school events that the?
Yes, so we, the school city of Mishawaka has already agreed to send the information to all of their schools, but we're in contact with other school districts as well. They're harder to reach over the summer. And then we have a list of community calendars and different places that we can promote it for free. Of course, we'll put some information on our own health department Facebook page. So lots of opportunities. And then the Ironworks Plaza that is, I believe, in connection with the city of Mishawaka, they also have a promotion schedule for events that are held there. So they said that they would be happy to send out information to their crowd too. So we're hoping that that will increase our reach.
Okay, great. Any further questions? Not, I'll entertain a motion.
I make a motion to approve item 2644.
Second.
Thank you. We have a motion and a second. Any further discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. We have no grant requests. We have no old business, public comment. Jenny, do we have anybody that would like to speak?
Can I just give 2 quick reminders about events coming up this Saturday at the downtown South Bend Public Library? We are having a safety event, a summer safety event, which is going to look at all the summer activities like swimming, and it's for kids, it's for families, but it is there, I believe, 11 to 1, Renata. 11 to 1, and the care department is doing that. And then also as a reminder, I know you got the email about Dr. Lindsay Weaver, the health officer for the state of Indiana. She will be here Monday morning from 9:30 a.m. to 11 a.m. We'll be doing a brief presentation, but she'll be hearing from our community members about HFI, how it has been very beneficial for them, and the success stories. So if what you're all invited, I think Jenny, if she hasn't, she'll be sending out a link for those who want to join online because they're not able to get away to come to downtown.
Great, thank you.
Jenny did send it. Thank you. Is it the 8th floor boardroom?
Yes.
You, next item on the agenda, time and place of our next regular meeting.
Oh,
Could I ask one question?
Sure.
Dr. Migliori, have we had any contact with residents from Gilmer Park as a result of the recent flood issues?
I have not heard anything, but let me ask Brianna.
Yes, we have.
Okay.
So we're a little limited in what we can do. So there's a few pockets of the county that have historically, they have had challenges when there's large amounts of rain, which obviously a week or so ago, we got just inundated with rain. So there's a few different neighborhoods that there's some issues there. We're a bit limited in what we can do unless we see that there is sewage within the water that has pooled. So we've gone out on quite a few complaints for flooding, and there's not a lot that we can enforce. A lot of times we refer them either to the drainage board or a different county department that might be able to help them. It is unfortunate and we would like to assist, but we're just limited in what authority we have in those instances.
Are you aware of, does the county council address this in any way?
I'm not sure. I know that they certainly send their concerns to council members, but I'm not sure what happens from that point onward.
Just historically, this was a major issue about 20 years ago, and the health board was directly involved in trying to resolve those issues for that part of our community, and unfortunately, it never got resolved. So a little sensitive to that. So it sounds like history may be repeating itself again.
Yeah, and no, and I feel very horrible for the people that have to experience it. But again, if there's no health hazard, there's not a lot that we
Yeah,
can do.
it's a council issue, but we're dealing with it as well. So, thank you.
I will say, like, I believe about 10 years ago, the county actually proposed to put sanitary sewer throughout the neighborhood. And then ultimately the citizens, the residents voted it down. They just didn't feel like it was affordable enough for them and stopped it at that point. But flooding wise, I haven't seen anything from anybody asking for flood relief.
Wait for the next storm.
It's not good. I live down there, upstream of Gilmer Park, but
All right, next time and place of our next regular,
Can I sit?
you want to do that now? Okay, I was gonna.
Yeah, let's do that.
I'm just gonna get business out of the way here.
Okay.
Our next meeting will be August 19th, 2026 at 4. Will not be here. How about anybody else? All right, cool. 4th floor.
Okay.
Chambers right here. Before we adjourn, we'd like to,
Oh, yes. So, you have been our health officer for 2 years, Dr. Migliori, and Diana has been consulting your right-hand woman from Maryland for those past 2 years. And we are so grateful. So we got you, well, got you some flowers and a thank you card. And we have a card for Diana and,
Thank
your
you.
heart care bonus. So.
Thank you very much. They'll be in my yard by this weekend. Thank you so much. Beautiful. Thank you.
Thank you to Diana as well.
Oh, she's awesome. She really is awesome.
thank you both. You really came to the aid of the citizens when we were in dire need and really helped us through tough times. And thank you for your continued service.
No, it's an honor.
Look forward to your next 10 years here. With that, we are adjourned.
Thank you.